Everybody, good afternoon and welcome to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich, also with Dr. Travis Gales, who is our health officer, and Dr. Earl Stoddard, who is our director of the Office of Emergency Management and Homeland Security. I'm Lorna Vigili, Hispanic Public Information Officer, and today as a guest we also have Ben Wu, who will be available for any questions pertaining some announcement that the county executive is going to make. And as you know, Mr. Wu is the CEO of the Montgomery County Economic Development Corporation. Reporters, all of you should have permission to record. If you do not have it, please request it utilizing the chat. And with that, I toss it to you, Mr. County Executive.
So thank you very much, and thank everybody for joining us again this week. I'll start, as I usually do, with a note on the COVID and our vaccination rates. Today, our positivity rate was 1.29, and our case rate was 3.15 per 100,000. We've seen our hospitalization utilization rates fall, as well as deaths. However, sadly, we're at 1,490 Montgomery County residents who have died from this virus. There are still 30 deaths per day in Washington, D.C. and Maryland, and we shouldn't get numb to that number. In memory of those we lost and their families, we remain committed to focusing on the health and safety of our residents. On the better news front, today we're sitting at about 52.3% of our residents who've received either both doses of Pfizer and Moderna of the single dose of Johnson & Johnson, according to the CDC data. We've hit 50% threshold on Friday of residents who've had both vaccines, meaning that on Friday, May 28th, right before Memorial Day, we will be aligned with the state at that time. On Monday, we hit 60% of our total vaccination, of our total population receiving at least one dose, but that equates to over 75% of residents eligible to be vaccinated. Businesses, restaurants, and houses of worship can immediately return to 75% capacity. It eliminates all outdoor capacity limits. Indoor capacity limits increased to 250 people, including camps and sports venues. Convention and banquet facilities can also operate at 50% capacity. Thanks to our residents, we are just 10 days away from aligning with the state's guidance and essentially reopening. Our vaccination numbers have been boosted by the 12 to 15-year-old cohort that just became eligible. Since Pfizer vaccine was approved, we've vaccinated more than 10,000 adolescents, actually 10,905, at our clinics. There are likely to be many others who've been vaccinated at other venues. This is 25% of those eligible in this age group who have already been vaccinated in the first week. That's pretty good uptake. We want to get every age group vaccinated though. We believe we have vaccinated the majority of residents who actually are looking to get vaccinated, and now we're moving on to the more challenging part. And we need to increase the percentage of our population that is vaccinated to more fully limit the spread and to minimize the virus's propensity to mutate by reducing the number of hosts it can invade. We continue to make the clinics more convenient and easier to take part in. We continue to work with FEMA to bring mobile clinics here. This week, FEMA's clinic is at the Lake Forest Mall until Sunday. We're working with MCPS to host clinics at several schools, and we're going to be at Argyle Middle School today. And we're aimed at the adolescent group, but all are welcome and encouraged to make appointments. And the clinic is going from 1 p.m. to 7 p.m. today. We're hosting clinics on weekends also to help make it more convenient for people who aren't able to take time off during the week. And in the end, we still need the public's help. We really need everybody in this community who's been vaccinated to be an ambassador and help us reach as many residents as possible with the message that vaccines are safe and effective. There's probably no better person to hear that from than one of somebody's neighbor in the community telling them that they got the vaccine and they're safer and they're fine. So we're asking people to help other people find their way to getting vaccinated. You can visit our vaccine website at www.govaxmoco.com for information on where vaccines are available, and you can make your own appointment. Again, you don't need to pre-register anymore. You can go straight to making appointments. Talk a little bit about masking confusion. We've noticed that many in our community and frankly across the country are a tad confused by the CDC guidelines, and many are thinking that there's not a need to wear masks anymore. So Dr. Fauci spoke about this, I guess, late yesterday, early today, and he noted that their guidance is being wrongly interpreted. He said there wasn't a general lifting of guidance on wearing masks. They just clarified that individuals who are vaccinated are safe not to wear masks indoors. That is not the same as saying you shouldn't. It's just stating what we know is that if you're vaccinated, you're actually safe to do this. But if you're not vaccinated, you must continue to wear masks indoors because conditions have not improved to the point that it would be safe to not wear masks indoors. This problem has been created because there's no way to check whether or not people are being vaccinated. This distinction is not enforceable unless we have a way of knowing who in a room is vaccinated and who isn't vaccinated. And if unvaccinated people do not wear masks indoors, they put themselves at risk, and they also put others at greater risk. So even if you're fully vaccinated, coverings are still required in many public places such as schools, childcare facilities, public transportation. And finally, and people need to remember this, any business can require masks. This is a decision the business has the complete right to make. And if a business requires a mask, their customers must abide, and if they don't abide, the business is legally allowed to refuse entry onto their premises. So if somebody tells you you have to wear a mask to come in here, there's nothing that the government's done that overrules that owner's ability to say no mask, no entry. So think about that. And still keep your mask with you when you leave home, just in case you're in a circumstance where you do need it. I'll talk a little bit about restaurant relief. This is, a big deal. This is probably the hardest hit sector of the economy. This and the entertainment venues took, the hardest beating of all during COVID. This week, I went over to Silver Spring to participate in the Taste the World in Fenton Village Festival, and I ate at Gari Kebab, a great Indian restaurant in downtown Silver Spring. This festival continues into the weekend, and there's great food from a variety of cultural traditions. Patrons who purchase food, dine in, or carry out at 3 restaurants during the week can enter to win cash prizes of $500, $250, or $100. Our restaurant industry needs help, and we're trying to patronize these businesses as much as we can in order for them to recoup the losses and return back to normal operations. Applications for a new round of Montgomery County Restaurant Relief Fund begins tomorrow, May 19th. MCEDC will award grants of up to $10,000 each to eligible local restaurants, food, and beverage establishments. And the grant monies can be used for a wide range of pandemic-related expenses. Yesterday, the Montgomery County Council authorized $3.8 million appropriation from the state to MCEDC for the 3rd round of local restaurant support. Funding came from the General Assembly Relief Act of 2021, which was signed into law by Governor Larry Hogan. Applications for that will be accepted on Wednesday, beginning at 10 a.m. through May 28th at 5 p.m. So visit the MCEDC website at thinkmoco.com to apply. Grants will be distributed to eligible applicants by June 30th, 2021. After the 3rd round is completed, MCEDC will have provided over $16.5 million in direct business assistance to eligible Montgomery County establishments over the past 7 months. The 2 previous Montgomery County relief funds provided grants ranging from $5,000 to $10,000 to over 900 county restaurants. We're prioritizing outreach to economically disadvantaged businesses, small, women, and minority-owned businesses. Eligible restaurants are also encouraged to apply for federal U.S. Small Business Administration Restaurant Revitalization Fund, which launched their program on May 3rd. The federal application and details can be found on the Small Business Administration website. On the topic of housing and rental evictions, Governor Hogan this week announced an additional almost $193 million in funding has been awarded to local governments and service providers. $28 million of this fund is coming to Montgomery County. More than 4,300 households received support in round 1 and round 2. Last month we released round 3, 59 million more, and have currently over 4,500 applicants for that relief. So this 28 million will come on top of the 59 million. Also, we're expecting to receive another $33 million from the American Rescue Plan funds for rental relief. So if we can get this message out to tenants and get them to apply, and if landlords will work with their tenants to get them to apply, we think we can go a long way to forestalling some of the evictions that all of us are so very worried about. As I mentioned last week, we have to do everything in our power to stop the evictions. We've petitioned the governor, along with other jurisdictions and the Attorney General, to extend the executive order protecting tenants for failure to pay rent actions, to allow time for rental assistance processing, and to extend the protection to tenant holdover actions. I want to emphasize that even as COVID winds itself down, it is likely that all businesses are not going to resume operations immediately. Some are going to be closed forever, and some are going to be delayed reopening. We know that people have a reluctance to going indoors. That's still evident when you go out. And until people are fully comfortable, many restaurants and other small businesses will not be fully operational, which means they probably won't be bringing back all their staff. And I say all that to point out that that means that unemployment may well extend beyond what we consider might be the end of COVID. And so we need rent relief that extends beyond the end of COVID to allow businesses to reopen and give them time to hire back people so they can go to work. I'm not confident that the state's eviction moratorium will be extended. I hope it is. It's critical over the next few weeks that we, increase our asks of the governor and the state to extend the moratorium. The federal program was dealt a blow by a judge that ruled that the federal protection could not be enforced. That is in court on appeal by the federal government. But frankly, if that appeal is not withheld, if that appeal is not supported by the court, we're concerned what that will mean, because this was a more direct way of helping tenants get protection. We're hoping that the Biden administration will issue another order through a department that has jurisdiction, because the ruling was based on their interpretation that the CDC didn't have jurisdiction to make that ruling. So we're hoping that if the administration can't get the decision overturned, that they'll offer the same protections through a different agency that does have authority. It doesn't make sense for landlords to kick tenants out before they're given enough time to get back on their feet. It's going to create a lot of vacancies, and you're going to have a lot of tenants who've been kicked out of one apartment building for the inability to pay rent who will be looking to come into another apartment building, and landlords will be needing tenants, and very likely much of the applicant pool is going to be people who've been vacated from another building. So we're hoping that everybody can maintain some patience while we sort all this out, and while we get more funds from the state and federal government to help people be able to pay their rents. We know this eviction process is incredibly intimidating and confusing to residents. We also know that when tenants do show up for their court hearings, that about 90% of them get some relief. Our concern is that many tenants are not showing up. In fact, about 20% of the cases that have been called, tenants attended. Now, it's better than the historical level of only 3%, but if 20% are attending, that means 80% are not attending. And if you're a tenant and you don't show up, the landlord gets summary judgment to move toward eviction. So this is a problem. There is an opportunity for tenants to get protection, and we're encouraging tenants to seek that protection. I've reached out to both the sheriffs and the courts to see if we can get help with renter resources, so we can get the notification out to tenants of what their options are and what resources there are for getting support for back rent. I'm glad to see our efforts in making progress, but we still need to do more to get this message out. And tonight I'll be joining Council President at the Montgomery County Rental Alliance virtual town hall. I hope renters in Montgomery County can tune in this evening at 7 p.m. So now I'd like to turn this over to Dr. Gales and Dr. Stoddard for their updates. And of course, open for questions when this is over.
Good afternoon, everybody, and happy Wednesday. I actually don't have a ton of updates to report beyond what the county executive has mentioned so far. He has highlighted where we stand in terms of community transmission. Our numbers have continued to improve. Where we do have a test positivity that's below 1.5%. Our case rate remains at, I think it's like 3.1 cases per 100,000. And we're starting to see a daily case report that has dropped to the 30 to 40 range. And we've even seen some days where there have been lower numbers reported than that. We continue to be vigilant, however, because we do know that there are variant strains that are out there. And while we certainly do celebrate, if you will, getting to a point where we can say that over 60% of our residents have received at least one dose, and 50%, and that number continues to climb in terms of our residents being fully vaccinated, we want that number to be even higher. So we don't consider this let's stop, spike the football, we're done with this. We still have a tremendous amount of work to do in making sure that every resident in Montgomery County who wants a vaccine has the opportunity to get that, because as has been demonstrated throughout the pandemic, our residents have been committed and focused to the public health guidance and recommendations that we've put forward. So we will continue to work with our community partners to extend and explore new ways to provide penetration within those communities where we have seen lower uptake so far. And we are excited that we have seen opportunities for young people to be able to get, young people being 12 to 15, to be eligible for the vaccine. As the county executive mentioned, we have vaccinated just alone the county apparatus well over 10,000 young people. I think actually over 12,000 young folks 12 to 15 have been vaccinated by the county apparatus, which represents over 25% of that population. So we're going to continue to encourage folks to get vaccinated, provide opportunities for them to get vaccinated, and to support our community partners and private providers in extending those opportunities. Now, we do recognize, as the county executive mentioned, and I'm sure there will be questions in the Q&A platform, that there has been some questions about mask guidance and so forth. We continue to support the notion that masks are effective tools at preventing transmission of COVID-19, particularly for those who have been unvaccinated. And particularly in indoor spaces where distancing are difficult to maintain, that is still a requirement. And as the state law has put forward in the governor's directive, there have been specific places and venues that have been identified that will continue to require face coverings regardless of your vaccine status. And so we want to make sure that folks understand that, and recognizing too that in spite of the CDC's recommendation that if you have been fully vaccinated, that it is safe for you to not wear a face covering, we recognize that many individuals within our community will still continue to do that until they develop a higher level of comfort and feeling of safety, and they should be supported in that and not be stigmatized or feel any sense of retribution for choosing to do so. As the county executive mentioned, businesses also have the opportunity to continue to require face coverings in their spaces, and we would support them in making that determination. So happy to answer any questions that you all may have. Thank you again for the opportunity to be with you.
Thank you, Dr. Gales. Thank you, Mr. County Executive, for the opening remarks. Dr. Stoddard, do you have some opening remarks as well?
Mine very, very short. So a few things. As you will note, the FEMA MVU, the mobile vaccination unit, is at Lake Forest Mall this week. So they're there until I think 8 o'clock this evening. And so obviously that's an additional opportunity made available outside of, sort of the daytime hours. As was alluded to earlier, we're going to continue to make these opportunities available in closer places to where people live, in different parts of the county, different hours, different days of the week. And that will be a continuing effort throughout the ongoing weeks and months to try and encourage people and give people more opportunities to be vaccinated. On the recovery front, we know that obviously with the reopening proceeding as it is, it does not mean the end of our response, but it also does mean that we need to really focus a lot more on some of the recovery elements of of how we move forward. Those things include mental health. Those things include the issues around eviction and housing. They also include business revitalization and getting people comfortable and feeling safe that they can go back into some of the establishments in Montgomery County. And so some of the things that we're really focused on over the next several weeks and months will also be trying to learn all these lessons that we had from COVID-19, thinking about the streeteries and some of the provisions around takeout alcohol or delivery of alcohol and food. And so we want to be able to make sure that we're codifying or memorializing some of the benefits of those activities, while also recognizing that we will be outside of an emergency in a matter of several months. And need to rely on existing laws and permits and things like that to allow those things to proceed. And so we've got work groups focused on how we allow those things to continue in a way similar to what they are now, but consistent with the non-emergency related laws and guidelines. The other thing we're also doing right now is really trying to get into some of the economic data to understand, for example, how the economy has likely been shifted potentially permanently, or at least for the foreseeable future, by COVID-19. Things like how has the COVID-19 pandemic impacted the future of retail sales, and how has it impacted the future of the hospitality industry, and how has it affected the future of our biotech industry, and accelerated certain changes or stop certain gains or other things like that, so we can make better use of our targeted efforts to try and improve certain businesses and industries, while also recognizing that certain things, we can't change the way public consumption will likely happen moving forward. We can just learn from what those changes will be and support our businesses in adapting to them. And so those are all things that we're focused on in our recovery efforts, among many other things. We will be looking at questions, working with our school system and other education through early childhood education and development, as well as Montgomery College, to really partner around addressing some of the learning loss that has been endured this year, and how we can help address that in the weeks, months, and years to come. I know this is an issue that's particularly of interest to our parents out there, but obviously it's going to take a village to try and recuperate some of the impacts that have been felt by students this year, and that's something that we're increasingly focusing more and more energy in partnership with our schools, school settings and systems education network. I think that's all I wanted to add for today, and I think that will get us to our questions.
Thank you, Dr. Stoddard, and let's get started with the questions. First one is coming from Corey Smith, NBC4, and I believe he might have questions for Dr. Gales and or the county executive. Corey.
Good afternoon, everybody. Yeah, this is for anybody who wants to answer. As you all may know, some local school districts, due to the change in mask guidance, have allowed students to decide whether or not they want to wear their masks outside during recess. There's also an impact in terms of the mask guidance changing on graduations. Actually, Montgomery County Public Schools just sent out an alert that their graduation season will start on June 2nd. Graduations will be held on campus. What guidance, if any, what discussions have you all had with the school system about the new mask guidance and any impact it could have on the rest of this school year, looking at areas like recess and graduation, and then moving ahead into next school year, when obviously we'll have even more people vaccinated and mask guidance may have changed again?
I can take a stab at it. Thank you, Corey, for your question. So the guidelines that you referenced in terms of face covering requirements in school settings, whether they are indoor or outdoor in the type of activity, have been determined by the state. And so the state has put in parameters and requirements for individual students and staff to continue to wear face coverings when in the school setting. And as it relates to outdoor, there is specific language related to that in the state statute. So this is an example where we are following the state guidelines as it relates, and as the county executive referenced, that there are a number of venues that are still subject to face covering requirements as laid out by the governor's directive, including school settings. Now, as it continues to move forward, as it relates to graduation and those types of things, I think, our policy that we put forward is still requiring individuals who are unvaccinated to wear face coverings in indoor settings. I suspect we will continue to have conversations with our colleagues at MCPS about developing and implementing any further safety parameters to help guide them in terms of making sure that their events are successful, that they meet the standards as set forward by the local jurisdiction as well as the state, and are done in a way that's safe and allows everyone to enjoy it as much as possible.
And as it relates to the fall, I think the only thing I would add is that we, obviously we're going to follow the whatever guidance is there in terms of the state. But I would just note that the Pfizer vaccine, which seems to be moving the fastest through the process of doing testing and ultimately seeking approval for younger and younger populations, I believe they've largely said that they will not be ready to vaccinate. I think the next group will be 2 to 11. That the vaccine is going to be used for, or actually maybe 5 to 11, I think is the next group, and then there's a 2 to 5. So 5 to 11 is what they're testing right now, and they had indicated they may seek approval for that in the fall, is what they defined as. I think it's August, September timeframe. So obviously that will greatly impact younger and younger populations within both the private and the public school systems. And so I don't think at this point we have any real way to predict what the mask guidance will be when it comes to next fall. But obviously, I think our intention right now is to be in line with the state of Maryland and really whatever is required for those settings by the state, whether it be the governor of the Maryland Department of Health or Maryland State Department of Education.
Thank you, Corey. The next question comes from Jordan Lindsay, my MCM, and it is for the county executive.
Hi, good afternoon, and thank you for hosting this. And it's actually for anybody else who wants to answer. I know you touched on this, but can you elaborate what the county will look like on May 28th when it enters into phase 3 of reopening? What will it take to maintain that? And what's the next step after that?
I think we'll look pretty open. You'll be able to do most of the things, all the things you were doing before. What will it take to retain that? No variants that are more infectious than what we're dealing with right now. No variants that start spreading through the community or infecting people who've already been vaccinated or who've had COVID before. I think that just because we're getting better doesn't mean we're done with this. And I think, Dr. Gales made the point, we have to continue to be vigilant because as we've seen around the world, the virus can take on different faces, and it's certainly what's happening in India has been really alarming, and Europe went through a period of totally alarming number of cases, and Brazil has gone through it. So we know the damage that this can do. So I don't take the approach that this is one and done. It's like we push this back. This is not going to be a total victory. This is not going to eradicate the virus from the human condition. And so we're going to have to make sure that we monitor what it does and make sure we have responses that are appropriate. But I'm hoping if the worst things don't pan out and everything stays on track the way we are now, that things look more and more normal as we move forward. I mean, a big thing is just people's willingness to come indoors. I mean, I was at a restaurant, like I said the other night. There were 8 people dining indoors that night. They could have seated far more than that with, masks and safe distancing, and people just aren't coming in. And I get the reluctance. So I think it's going to be a while before people feel comfortable in indoor spaces. And, particularly in stores, I know people who've said that if they see people walking around without masks on in a store, they're just turning around and going out. So, I think it's going to take a while for us all to adjust. This has been traumatizing for people. this is, people talk about the damage this virus has done psychologically. I think it's done a fair amount of damage psychologically in terms of people's comfort levels and how they move about the community. So I think adjustment's going to take a while.
Thank you.
I would just add one thing to what the county executive mentioned. One effective tool that will also help us continue to be safer is for folks to continue to get vaccinated. So for the folks at home who have not been vaccinated, for whatever reason, if you have some hesitancy, I'd be happy to address your questions. But the higher percentage of folks that we have covered with the vaccine, whether we achieve herd immunity or not, whatever that magical number is, gives us a greater sense that we have more folks protected within our community, which decreases the risk of a potential another wave of cases that we could see in those who've been unvaccinated, and gives us a greater sense of comfort that by reopening, we won't be hit by another wave and have to walk back any of those provisions that we've put forward.
Thank you.
Thank you, Jordan. Next question is coming from Randy Bass, WDVM, and it's for all officials.
Good afternoon. Thanks for having me on the briefing. A question about reporting of data in the 12 to 15-year-old age group. Is that age group also included in the statewide system? I think in the past I've heard you refer to it as Immunet, that tracks vaccination data between counties in the state and throughout different venues of vaccination in the county. You've said around 10,000 or plus teens and tweens have got their vaccine this past week through county vaccination clinics. Is there a delay in getting the numbers on kids vaccinated through other venues and also including them in that total? Is there a reason why we don't have the full count on that age group?
So that number is pulled from Immunet. Folks are required to upload their information to the Immunet system within 24 hours. So there is probably about a 24-hour delay up to a 24-hour delay from when someone is administered a vaccine and when it hits within the system. So I'm reporting the county ones because I know how many we've delivered directly from the reports of our staff.
I would just say, Randy, just for your knowledge, having looked at some of the data and tracked it over time, you will see increases. People are supposed to report within 24 hours. My suspicion is some groups are better at it than others. And we don't know because obviously the data is going to the state level, whether some have reported or not. We don't know who has reported. We know we've reported, but we can't account for any particular pharmacy or hospital or other provider, how fast they're reporting. But you will see the numbers sort of progressively update as days go forward on previous days. So if you look at like last, let's say Friday, I'd be willing to bet you that number looks different tomorrow than it does, today. So that's just typically the way, if you just track the numbers over time, you'll see.
I appreciate you both clarifying that. And another question for the county executive. Yesterday, Governor Hogan signed into law a 2-year extension on allowing carry-out alcohol from bars and restaurants in Maryland. Are you in favor of allowing that to continue here in Montgomery County going forward?
Yeah, I mean, as long as we adhere to, proper limitations, the worry everybody always has is, does this become something that incentivizes drinking and driving? I mean, let's be honest, that's the fears. I've now put a vodka martini into a container to go, and all of a sudden it's sitting next to you in a car, and the worry is, are people going to drink? We have not seen, near as I can, I've heard that this has been a problem. I hope that, this is one of those things where people realize that the price of, our lightening up on some traditional restrictions is that everybody has to behave in a way that doesn't require us to have these restrictions. So I'm happy to see this going forward. It was good for the restaurants to be able to do this. I anticipate it'll continue to be good for a restaurant to be able to do this. So I hope this can work for a couple of years, and maybe it becomes permanent after that.
Thank you all. Appreciate it.
Thank you, Randy. Next question comes from Steve Bonnell from Bethesda Beat, and it is for the county executive.
Good afternoon, County Executive. You just mentioned a stat earlier that only 20% of in cases tenants show up to their eviction hearings. It's kind of a two-pronged question here. Just curious where that number's coming from, and then also just kind of your understanding why that is. I know you said it was getting better, but obviously 80% of people not showing up to kind of make their case when they might be thrown out of the street is kind of an interesting thing.
So the statistics coming from folks who've been observing the courtroom and looking at how many cases are called and how many times tenants respond. So it's informal, but it's the information we've gotten. There are a couple of community groups, or what's the right word for them? Nonprofit groups that have been there to help tenants and are kind of monitoring the court proceedings. Look, the problem is most people who are dealing with landlords surrender. The truth is that over time, people are used to not winning, and a lot of people probably don't know that, the governor, that the state, and at one point the federal government had restrictions on evictions. There are a lot of folks who aren't tuned in to news at that level and may not think it applies to them. So 20% is almost 7 times the rate that was normal in the county, but it still means that 80% are getting lost. So we're, doubling down on our messaging. We're using all our nonprofit partners to get to the diverse communities out there. The defense, if you bring the documentation you need, is pretty straightforward. You demonstrate that you're out of work because of COVID. It's the federal government was a little bit simpler, but either one of them would get people to the point that they could get protections for a longer period of time. So we're going to continue to try to keep that message, because we're going to have a real problem if 80% of the tenants who could get evicted. It's going to be really difficult to figure out where they go. And like I said before, landlords are going to have a hard time finding somebody to fill their vacancies who isn't somebody who was evicted from some other apartment building.
And kind of follow up, you mentioned, I think it was, a lot of numbers, but there's 30 million or maybe more than that or less coming in to help with evictions. Do you think that's enough, just tracking, all the money you've been doling out since the beginning of all this, that's going to make a dent?
Well, look, if I take the 58, the 28, and the 33, I'm around the $110 million. That doesn't count the money we gave out in the first 2 rounds. So I don't think it's insubstantial. I think it'll certainly make a serious dent in the problem. We're hoping, and some landlords have done this, they're willing to forbear some part of the rent, that, if our assistance, I think, is limited to $1,000 a month, $1,000 a month, including, for back rent, is better than nothing a month for back rent. And, we're asking that, people, that in exchange for the money, that people don't get evicted. I think we can help the businesses and the landlords make up for money they've lost if they're willing to work with the tenants to get access to the money we have. And maybe that's another thing that we need to double down on, is letting landlords understand that if you evict somebody, you may be evicting somebody who could actually work with us to get you the back rent, which you will not see if you evict them. So I think everybody has a reason to cooperate with each other.
Thank you, sir.
Thank you, Steve. The next question comes from Kevin Lewis, ABC 7, and it is regarding the county's ag fair. Kevin.
Hi there. Yeah, so as we look ahead to the summer months, what is the game plan for the ag fair? I think I had seen somewhere earlier in the week that goal is to have an ag fair that looked like it did before COVID, but if you guys, whoever wants to take the question, could elaborate on that.
Yeah, Mr. Spurzek, the executive director of the Montgomery County Agricultural Fair, did submit a COVID plan on Monday. We're in the process of reviewing it, but generally speaking, because we will be, obviously it's scheduled for mid-August, I believe the 13th through the 21st, 13th to the 21st, that's correct. They're going to have procedures in place to make it safer, but obviously we won't have any capacity restrictions, required upon them, but they intend to follow some basic safety procedures to allow the event to proceed. And so without having, reviewed the plan all the way, we have a group that's focused on that. I don't know if there's any specific changes that we're going to request, but I see no reason why the event won't proceed at very similar to what it was before COVID.
And so, not to put you on the spot at all, but it doesn't sound like there's any changes that come straight to mind. I think of like the carnival rides where you're in those like tiny confined, cages with someone else. No word if those rides would be under certain rules or anything of the sort, but there would be, the thought is, some kind of safety mechanisms in place.
Yeah, their plan's about 10 pages long. It just goes over some major activities and obviously they'll do wipe downs and things like that to keep the surfaces clean, but I don't expect there'll be some significant restrictions on those. Obviously, I think 95% of the event is outdoors, which obviously is great. I think only about 5% occurs indoors in any way. And so obviously that makes it substantially safer. And obviously, I don't expect there to be any significant limitations on the number of people they can have at the event on any particular kinds of activities.
Just on the topic of summer events, has Montgomery County discussed its plans for 4th of July and fireworks displays?
It's in the early stages, but the plan is to, I think the current intention is to have fireworks displays as we have in the past, but I know the Department of Recreation is working on those since they do a large portion of the planning. I know obviously our municipal partners do as well. And we've shared with them that we don't expect that they're going to have any significant limitations, but obviously the planning process is ongoing. I don't think we have anything finalized at this point, but from the perspective, certainly from my perspective, I don't think that there's going to be any public health limitations that are going to preclude them from having them.
Appreciate it. Thank you.
Thank you, Kevin. Next question comes from Caitlin Peets, Bethesda Pete, and she says, it's a quick question for you, Dr. Gales.
Hi, I was just thinking, Dr. Gales, when you said, as we are making progress in vaccinations, there's still some concern about variant strains and things like that. If I'm remembering right, at some point, months ago, you had given us an update with how prevalent those strains were in the community. Is that still, am I remembering right? And is that still information that you're tracking that you could give an update on?
Hi, Caitlin. Thank you for your question, and you are correct. We do track them. The state probably has the best, most up-to-date information on the variants, and I do believe that information is shared on their public-facing dashboard. We do get updates, however, in terms of when cases are sequenced and reported, and we do have, I believe we've noticed before, but we do have seen cases of all of the most concerning variants that have been reported throughout the recent history, including, and I'll use the geographic names, although they encourage us not to, the New York variants, the California variants, Brazil, South African variants, as well as the UK variant, and we have had some reports of potential variants related to the Indian variant strains that have been reported in the last few weeks.
Is that okay, Caitlin?
Yeah, I think that answers the question. Thank you.
Thank you so very much. Those are the questions that we have on the chat from reporters. Reporters going once, going twice. All right, we're going to take a couple of questions today from our Facebook Live. And the first question says, or requests, please update guidance for outdoor sports and camps and pools for children under age 12 to not be required to wear a mask. Who would like to take that question? Guidance for outdoor sports and camps.
Well, as we noted earlier, unfortunately, 12 and below still falls into the unvaccinated category. And so that while the general guidance around wearing face coverings in outdoor settings has been removed, at the state level, and as noted, we will May 28th, we will be consistent with that. There are still special provisions within which face coverings will be required for certain settings where young people may be, including camps and those types of activities. So, you know, we actually have received some questions on the other end saying, you know, well, what are the protections in place for young people who can't get vaccinated? So I want to assure folks on both sides or all sides of the issues that there are still some specific times and places and venues within which folks will be required to wear face coverings, and others in a sense where those face covering rules will be relaxed. And so the website will be updated to appropriately report what those updated findings are from the local level as well as the state.
I would just say we're not permitted to be less restrictive than the state of Maryland, meaning if the state requires face coverings in schools, for example, we can't at the local level say that doesn't apply to Montgomery County. We can't be less strict than the state requirements.
Thank you. And just to follow up to that response, what about gyms? And I promise this is the last one. Gyms?
Gyms are you're not, so right now, as of the Board of Health acting yesterday, you are not, if you are vaccinated, you are not required to wear a face covering inside of a gym unless the gym itself determines that you must. So there are some gyms that I think Dr. Gales has already referred to, I think that intend to keep their mask guidance in place. There are others that will likely align to the minimum requirement, which is that only unvaccinated people must wear a mask inside. And so I think it will vary gym by gym in the county. And I think one of the things we would tell you is bring your mask with you when you're out and about, even if you're vaccinated, because it's likely that some establishments, retail, restaurants, fitness centers will still require those to be worn. Others will not, and you'll determine that once you get to the door and see what they require. And if they require it, you are required to wear it, or you'll have to seek to go somewhere else.
Thank you, Dr. Stoddard. Thank you, gentlemen, for participating today on this media briefing. I think we are about to be done. Reporters, once again, going once, twice. All right, this is it for today. Thank you, everybody, for joining us. And of course, we'll see you again soon. Have a great afternoon. Thank you and stay safe.